are on the call as well, who are team members as well. Please, if you can, hopefully you can hear me okay. I'm full of cold and I've got this horrible chest infection. So I'm hoping that my voice will last. If not, Hannah's kindly agreed to jump in. If not, if it sort of disappears as I go through. Fleur, are you okay to start sharing the slides? Is that all right? Can everybody see them? Great, perfect. So thank you for inviting the team here today. We've got, I believe, 30 minutes to talk through this presentation, which is really a significant part of our study. And we're looking at, it's really linked to two other funding streams that we've got, which I'll talk about as we go through the presentation. But the presentation today is really looking about how we are working with members of our lived experience advisory group and really bringing their engaging the women and bringing their lived experience to the fore throughout the project of this. And so that's what the presentation is about. We've got a great team working on this study. I am the co-PI with Carolyn Chu, Professor Carolyn Chu Graham, who's based at Kiel, who cannot make it today. But saying that, everyone's significant in the team as much as the PIs on this programme. So we've got Dr. Hannah King will come in as well. And we've got Paula Harriott, who's the lead of CEO for the Unlock charity. And we've got Fleur as well, who's on this, who's the main researcher on this part of the project. But we've also on the call got Dr. Katie Cowan as well, who's a researcher on another part of the project, and Faye Dunn. I'm really pleased to say that Paula's got Faye with us today, who's part of our lived experience advisory group as well. But I'll leave them to actually do their own introductions as they come on to the talks of the slides as well. So it is a very much a joint effort, this programme of work that we're doing here. And it's really about just sharing this experience today with that, the presentation on that. Fleur, can you do the next slide, please? So we are going to keep it quite tight because we really want to hear from Hannah, Fleur, Paula, and in particular Faye in this presentation, because that's what it's all about. So I'll be just giving a quick overview of just where the funding's come on the overall presentation, but we're really wanting to hone in on the lived experience of the advisory group members and Faye's account of that, and Paula's work on that. And in particular, Paula and Hannah lead that section of the programme for us on the funding grant. So we've got a little bit of introduction to the IPSITS project, an introduction to the lived experience group, how the group was established, the project work being completed to date, and the co-production with the women with the lived experience of the imprisonment. And then we'll talk a little bit about what we're actually doing with the LEAG in terms of the work that's currently underway about enhancing their research experience and being part of our co-production of the work that we're doing on the programmes of work that we've got as well. And then the really best part for me of this presentation is the LEAG group's members' perspectives on this group membership and how they feel this is going and the impact of that. And that's where we're hoping that Paula and Faye will really pull that experience through for us. And I see that as the main part of this presentation really today. Fleur, next slide, please. So quick overview. We have the IPSIS study is basically a study which is running from September 2024 to June 2026. And it's a NIHR RFPB funded study, which is entitled Improving Primary Care Services for Imprisoned Women with Severe Mental Illness. This is a period of work that I've been doing with me and Carolyn from since 2021, where we're really wanting to get an understanding of what primary care services. So these are services that are in prisons for imprisoned women with severe mental illness, such as having access to a GP, having access to physiotherapists, occupational therapists, sexual health, dentists, the basic core things that we take for granted in the community, and how women in prison with severe mental illness can actually access these services as well. So in this study, it's purely qualitative, and it's two key aims really, is to explore the range of primary care services delivered to imprisoned women with severe mental illness in England, but see what's working well in these services, but also what's the barriers to accessing this care. And the other framework that we wanted to have at the end is after we've done this mapping exercise, really within that, and I'll come on to the 3 phases in a minute, is to have an understanding what is required going forward. So this really is the first phase in what I see as a programme grant piece of work further down the line, where we are wanting at the end of this to establish a framework which is looking and showing which we think will be a lack of services, if we are honest, for women's prison services to support primary care needs. But we're keen on looking at racially minoritized women with SMI within them prisons as well. So we get that whole perspective of what's required for different women's experience from different ethnic minority groups about that as well, and what's required. Fleur, can we have the next slide? So in a nutshell, we've got 3 phases for this project. It's phase 1, we're doing semi-structured interviews, telephone, online interviews with primary care practitioners in the prisons, and we're all looking to get up to 25 people across the 12 English prisons for that. We've currently got 7 undertaken so far within that. Phase 2, we are doing discussion groups within prison women with SMI from a range of different ethnic groups. Now, some of these will happen in prison and some of these will happen out of prison. But the aim is that we'll have 6 groups, hopefully, across the region. And there'll be 5 to 8 women in each of these focus groups, discussion groups, with a total of 40 women participating in them. And phase 3 will be consensus groups with prison healthcare and non-clinical staff. And we're aiming to try and get a representation from the 12 prisons in England where we access the discussion groups with practitioners in each of them prisons as well, to establish this framework at the end by June next year in relation to that. So what I'll do now, I'll pass on to another member of our team. Can you just do the next slide, Fleur, for us? And I'll pass over to Paula. Thank you.
Shall I jump in?
Yes. Yeah. That's
hello. So yeah, I'm Paula Harriott. I am the CEO of Unlock, which is a lived experience led charity working with people with criminal records. But I think my particular involvement in this project is I am a specialist in building engagement and PPIE, and I've been doing that for over 15 years now. But I suppose what drives me with great passion and deep compassion and care for this work is that I'm also a woman who's been in prison. So I served a prison sentence between 2004 and 2012 and outside, and so I really can connect with how prison spaces affect people's mental well-being and the barriers to engagement. So I think that bring that lived experience of my own situation into the work, and so this work is both professional and personal for me. I think what Tammi didn't say, and I should say, is that women with lived experience also informed the proposal to the fund. And so this work, the IPSIS work, started out as a real co-production between people with lived experience and the research team. And I think that has also, helped some of the women from the lived experience advisory group were part of that initial group with whom we consulted to co-produce the original proposal. So there's been a sense of ownership from the lived experience advisory group right from the get-go. And I think that has really helped to deepen engagement and deepen trust from the LEAG to the wider research project. So I led the recruitment. Using a mantra that I use quite often in these spaces, which is that getting the recruitment right is really helps build the engagement in the project over the long term and helps to unearth the deepest wisdom and insight, which is to find women who've got direct lived experience of the issue at hand, that is like mental ill health in prison, and whether they've had that indirectly, i.e. working in prison spaces to support people with mental health, or have experience of that themselves. And we want to try and find people as well. We have found people who are still struggling with the mental ill health that they struggled with whilst in prison. We have women who had mental ill health but never would have engaged in the prison environment, so they can really talk to us about the barriers. So we're looking for those that have engaged, those that haven't engaged, and for those that for whom it is still a living experience and not necessarily a lived, i.e. in the past. It's one that they have carried through prior to imprisonment, through incarceration, and after imprisonment. So I think we have 11 women with this diverse range of experiences. We have women of the group is predominantly made up of women of colour, and well, it's about 50-50. And some of the women who are in recovery hold positions of advocacy that I would say that if they weren't activists before they joined our PPI group, they have now become activists in our space, and all very keen to contribute and to give their advice to the team. I think that we've worked as a whole research team, and I think the success of our PPI group, i.e. the impact that it's having, has been because all of the research team have worked really hard to create a safe space. We've really thought about in this space, how do we come into this work with mutual and reciprocal knowledge exchange at its heart rather than extraction? How do we give as a research team to the space? How do we recognise that we need to be flexible, especially when people are currently living with mental illness? We've had to give some thought to people who might drop in and out. That's why there are 11 women, but it's not always 11 women that turn up consistently. Some people have to step away because they're not well. We try to build autonomy, so for people to be able to offer, to not feel like they're following the direction of the research team, but challenging and acting from places of authority and expertise. We've built that understanding that lived experience is an expertise that we really value. And mutual support. We've got a really vibrant WhatsApp group with the PPI team members, where we are witnessing that bringing people together in this very generative, feminist, values-led space has really enabled women on the PPI group to bond with each other and with us as the team, and you can see how they lift each other up in the way they speak about each other in the group and the way that of the group. So thank you. Next slide. Just to tap into what we've actually done. So we've been thinking a lot in the group about how we've built the conditions for such a vibrant group. But what we've done, I think that as the research program has started to get underway, they were involved in all the ethics applications. They were involved but I think they were involved in setting the scene for us in order to do those ethics applications justice. I think they really helped us to think through the challenges to discussing mental ill health in prison, the vulnerability of people with mental ill health in prison, the way in which different sentence types would cause people to hide their mental illness. The women of colour talked about how difficult it is to talk openly about your mental ill health with this sort of notion that it can be misconstrued as aggression or fear of mental health services that aren't culturally competent. They really helped us to set the scene just in the first initial sessions when they were talking about why they wanted to engage, what their experiences and what they thought they could offer to the work packages. They really, I think, a critical point that they made to us was that we need to step back like they were very vehement about saying, listen, don't talk about focus groups to discuss your mental ill health, like nobody's going to come. You need to like or you might get overwhelmed in that everybody will say that they've got mental health. What are we talking about here? They talk to us about using language like discussion groups, and you'll see that Tammi meant in the program of work that Tammi, the slide that Tammi talked about earlier, we're talking about discussion workshops. We're talking about participatory workshops. We're talking about not putting things up on the wall saying, do you have mental ill health? Do you want to come to a focus group? You know, this real genuine sensitivity about working through how you engage people. And they were so clear about giving us the right type of language to use, about who in the prison subcultures are the people who use to encourage people to come to the workshop that we can approach to help us find people who want to talk about mental ill health in prison. And we definitely talked about the appearance of the information sheets, the language in the consent forms. We talked about, for instance, printing them on pink paper. We talked about putting much more visuals into that and stripping out the formality of the language to as best we can. And this was very important to them. And also this idea that we bring something to the people who give us information in the workshops, that we're not just sitting there taking away stuff, that we're making commitments to come back and talk to the women who take part after the research has been completed, that they feel empowered by the experience of being part of research. And they were very clear messages from this group to us. Next slide, please. Just about so this notion that we are creating a LEAG group, we have created a LEAG group with this notion of co-production at its heart, which started with the original proposal. As part of this work, the team have done a literature review that engaged with women with some research, and in the UK we've seen very little published work to date co-produced with criminalising women, apart from Pat Carolyn years ago with Chris Tchaikovsky, some work with criminology and women with lived experience. It's quite sparse, and I think I should mention here my own work in this domain. I wrote a paper a few years ago, I think it's 2021 during COVID, called Service Users Being Used. The link to anybody who wants it, but it really talks back to and I wrote it with my colleague Michaela Booth, who works for Practice Plus Group as a patient and public involvement coordinator herself. And we talked about our experiences as women in prison of being researched, and how that felt in terms of extraction, how that felt in terms of anonymization, how that felt in terms of less connection of the research around, you know, troubled communities, how that felt as being a member of that community, and to see yourself identified as such subsequent to the research being published, and how that labeling can cause internal turmoil. So I think one of the key learnings that we have brought to this is that we want this experience for the PPIE group to be empowering, and for us to be very mindful as a research team that that everybody learns in this space. It's not just that the research benefits in terms of, you know, deepening the research by virtue of having a PPIE group, but that overarchingly everybody involved, you know, the lived experience group, feel empowered as a consequence, and that there's actions, meaningful actions that come out of this research. I think the PPIE group have been very strong with us about that, about saying, you know, we just don't want more research, more research, more research. We want a commitment to moving these to policy spaces, taking actions, and even in the moment of doing the research, doing our best to influence and impact on relationships in the prison, and trying to eradicate some of the barriers to engagement that they had mentioned. and also looking at how we can bring the PPIE group. They are on our governance board, for instance. They do come to our steering committees. How do we think through what those barriers really are and how might we improve them for the future? So I think that a key part of this co-production within this research has been, how do we ensure research engagement is meaningful for the lived experience researchers, both within and beyond the project, and how is our research, the IPSIS project, going to make a real radical difference to the experience of mental health in prisons? Because all of us who've been close to it, and all of us who have listened to their PPIE group's experiences, have literally been moved to action, not moved to sort of being shocked, but moved to, want to really make this project successful and take the learning of it forward. And handing back to my colleague.
So this is just me just to give it. So basically we have got the IPSIS project, but running alongside of that, we've got the 3 schools mental health programme grant, what we got as well. So I just wanted to quickly just mention a little bit about that, and after Paula's wonderful telling us all about our LEAG and everything there. So basically the 3 schools mental health programme grant, what we've also got running alongside the IPSIS study as well, is a project to improve patient and public involvement engagement, specifically for the LEAG, on this piece of work that we're going to be talking about today. That started on the 1st of April 2025, and that's running for 12 months. And that's got 3 phases. And this is what we're going to give you some more information about later on in the next set of slides. But basically, it's just got 3 phases. We are conducting a needs analysis and research training with the LEAG members. This is all being done through co-development, through data collection and evaluation tools, and co-analysing data. And we are working in co-producing the research training with them. So they are being trained as we would train any researchers on a research project. Phase 2 is about the production of some creative outputs for women in prison, so they can know about what research is, what it entails, what it will be involved in working with prison researchers. And again, this is co-developed with our LEAG members, and we've got artists who are going to produce some creative outputs about that as well. This will be led, the creative outputs will be led by what our LEAG representatives believe is the required creative outputs. And then phase 3, we'll be doing a dissemination to a number of key stakeholders, including women in prison, co-design and co-facilitate with the LEAG. But we will be putting on a conference next year, which will be probably in the summer next year, which will be led by our LEAG group as well here in Durham for that. Next slide, Fleur. Thank you.
Okay, so I'll come and talk a little bit about the needs analysis that we developed. So we had that kind of idea about how do we develop the lived experience engagement through that 3 schools grant, and thinking about what do we need to do to fulfill the women's kind of like development needs, what can we offer? So first off, we did a needs analysis that we developed ourselves, and we just asked our LEAG members to fill in a survey about their own kind of current knowledge and how they rated their own skills about research, different aspects of research, IT and literacy skills, communication and organisation skills, and personal skills like teamwork, leadership, creativity, and their confidence in their own expertise and their role as an expert by experience. So we just asked them what they rated their current knowledge and how much they think they needed or wanted training around that particular piece of knowledge on a Likert scale. And we found that, so the main kind of need that came across was around research, about understanding different aspects of research, particularly things like ethics and analysis, and maybe a higher need for training in presenting research. Generally, IT was all like, most of the women felt comfortable with their IT skills, communication skills, organisation skills, and personal skills. But within there, we identified some specific kind of needs that we can think about. How do we build that bit of training into the programme that we develop with the women? So things like maybe like security and things like that. So we can work on that as we go through the stages of training with the women throughout the programme. We can think about what their specific kind of areas of knowledge that they wanted to build up. But generally, they really wanted some. So even though within the LEAG, we've got women who've had very little experience engaging with research and some that have had quite a lot of engagement with research. But even those that have quite a lot of engagement with research really showed that they wanted, a more in-depth training, a more training kind of on a level of an academic as a co-researcher, so that they can develop their knowledge within research and become really confident experts by experience and build their kind of knowledge of the research process so that they can engage as much as they can in every level. So now I'm going to pass on so that's how we've kind of started to develop our training and development plan for the LEAG. So I'll just pass on next to Hannah, I think.
Thanks, Fleur. Hi, everyone. My name's Hannah King, and I'm an associate professor in criminology at Durham. I've been teaching in prisons for the last decade through the Inside Out prison programme, and also not quite almost as long, undertaking research and work with women in prison, led by my colleague Kate O'Brien, who I think's on the call. So I'm just going to put 2 links in the chat there to you, and a plug for another project we've been involved in around mothers' experiences in prison, and participatory theatre with Open Class, and there's a screening tour happening at the moment. But back to this plan. So one of the things that's been really important when we've been meeting with the LEAG is understanding and recognising that if we want to go through this research project properly, that we really need to be able to support the women to have the skills that they need in terms of research. So as Fleur mentioned, we undertook the needs analysis, and from that we've identified a range of other things that we would like to, and we're in the process of facilitating with the women. For example, looking at exploring opportunities for further education and employment, developing things like a LinkedIn profile, CV building, and Paula and Locke have been really instrumental in doing this, so that we're actually able to think about bringing the other wider opportunities and connections and resources that we have access to as a research team, so that they can really be used and harnessed to benefit the women who are part of the lived experience advisory group. So we've been taking them through, started the process in terms of research methods. So starting with some kind of initial research methodological research training, thinking about all of those different phases in the research process. So like Paula mentioned, right in those early conception stages, we've then also been thinking about the design of the different tools, the ethics, but also now about the actual doing of the research and how we then move into the later phases around analysis of the data and how we bring that together in terms of different formats for disseminating the research findings once we get to that point. But we're also really keen to explore the experience of women with lived experience as lived experience researchers. So it's not just about those topical expertise, it's also about a reflection on the researcher experience for themselves. Can you move to the next stage? Next slide, please, Fleur. So one of the things that we have just begun with the group is undertaking participatory research training as the next stage in the training process with them. So at Durham, through our Centre for Social Justice and Community Action, we've kind of got world-leading researchers who work in the area of participatory research, And over the last few years, they have developed a participatory research, innovation and learning lab. And that has really been focused on how we can harness all of the evidence and knowledge that we have around participatory research to be able to develop more creative and innovative tools for facilitating participatory research training. I'll put a link to that training and the resources we're using in the chat as well. But one of the things that's really important here is about when we think about what do we mean by lived experience research contributions, what do we mean by PPIE, and what do we mean by participatory research? And that's something that we are in the process of engaging with about these different the different language that we use in different spaces, and to what extent these are different, what this means in terms of the work that we're doing and the experiences of the women. I'll pass on to Fleur to the next slide. I'm not going to say any more because Faye will be able to do it significantly more justice than I can.
Yeah, so we had one session with Hannah to start that PRIL training. The rest of that PRIL training will run alongside the kind of research activities. So as we get into analysis, her analysis session will kind of run alongside that. So we're doing this development alongside the kind of, so the training alongside the activity itself, so that we can really put that into practice. Oh, sorry, I've missed a slide. Let me go back, because we also engaged. So we've had one session with Hannah, and then we had a 2-session kind of bespoke training research with Lucy Wainwright from Epic Consultants. So she looked at our project, she looked at our group, and she kind of formulated a 2-session plan about getting really in deeper to our question, our chosen methodologies, and the role of lived experience. So all the time when we're working with the LEAG, we're thinking about not only the Ipsos study, so the data that's coming through that and the processes of that, but thinking about the role of the lived experience and their engagement within the process and how that actually works. So we've got kind of like a 2-level thing. We've got the Ipsos study, which is about the mental health, and then we've got the women working with us on the LEAG and thinking about what does that mean, what is that, and we're going to have outputs for that for the 3 schools funding. So with Lucy, we looked at the kind of participatory ladder, different levels of engagement, where we sit on that at different stages of the project, and we thought about some of the barriers behind that. It was really reflective and really kind of like bringing the women and everybody's opinions into and experiences into thinking about those things and how that sits within the Ipsos project. And then in the next session, we had a really deep dive into research ethics and research governance and how those things impact particularly women in prison. There's obviously massive complexity around the ethics of engaging with women in prison, and the ethics of engaging with lived experience experts as well. So we had a really good think about that. And then we came back together, reflected back on what we'd learned in the last 3 sessions. So we've had 3 quite intense training sessions, and then a nice reflection session where we thought about knowledge equity, and got some feedback on the women about their experiences of engaging with that. So next I'm going to pass back to Paula and Faye just to talk a bit about how the women experienced being in the LEAG, experienced the training and what they bring from it. Okay.
Yeah, thank you. I think it'd be great to bring Fleur in. Fleur, are you there?
Faye, do you mean Paula?
Oh, Faye, bloody heck, Faye.
Yeah,
Faye, are you
okay.
there, Faye? So Faye,
Yeah,
I mean, maybe you want to talk to this slide. I mean, first of all, like, you know, how have you experienced, like, where have you come from? Who are you? Like, what are you getting from being as part of this project? What's your experience of it?
Yeah, no worries. Hello, everyone. So yeah, my name's Faye Dunn. I also have lived experience. I initially came into contact with Paula through Prison Radio Association, which is the organisation I now work for full time. Paula and I do a podcast together, and that's how we initially came into contact. But Paula knew I had a major passion for women's mental health, particularly when they're obviously living inside prison. I tend to use sport as a way of dealing with women's mental health. I've not got any kinds of mental health struggles myself, but it was an absolute eye-opener to me, the amount of complex mental health needs and the lack of support within the system for women with those complex mental health needs who are unfortunately serving prison sentences. In terms of getting involved in the LEAG group, I just want to kind of mirror what Paula said and really champion the work that Paula does, because I think it's really, really important to I think it's really, really important to have people with lived experience at the forefront of any research that you're doing going into back into prisons, because one of the reasons the LEAG group works so well is because the 11 individuals, including myself, who were in the group, all buy into not only Fleur and the team, and Hannah and the team, but mainly Paula, because she's been there and she's lived it herself. And there's no, it's all good and well academics coming in, it's all good and well additional third parties coming in to deal with women, but somebody with lived experience is going to get them greater buy-in from anybody else dealing with women, particularly with complex mental health needs. The group for me is absolutely fantastic. I mean, Paula touched on it before. She mentioned about the WhatsApp group we have. There's some individuals such as myself who haven't had complex mental health needs, but they like to they've seen it and they've lived and breathed it with people around them and they want to make a change. There's people who have had complex mental health needs who are now better, and there's people in the group who are still living and breathing, dealing with those needs every day. And the group works so well because of the different range of individuals that we've got in the group who are all there supporting each other day in, day out. I mean, we've had messages just this morning. Being a part of the group for me is huge, because, and I'm guessing it is for the other 10 women as well, because having been surrounded by all of these complex issues for whatever period of time it is for each individual, you feel as though you want to make a difference. And by being involved in this group, you feel like, even though we're getting training in terms of the research side of things, you feel like your input is making a difference. And I think that's kind of what brings the group together so much.
Yeah. It really does, doesn't it, Faye?
Yeah.
So thank you for that, Faye, thank you for that, Faye. But I think you've really talked to how important it feels for the LEAG is very important to this project in a way that I genuinely have not experienced in other research projects to date. This is to the point, Faye, you even WhatsApped the other day, are there any other things that I could do? Like, I've got the bug. This feels like this isn't a project where people are dropping off in engagement. If anything, this is a project where people are ramping up their engagement. And in PPIE groups, you do often get a lot of enthusiasm at the end, but at the beginning, but then by the end, the PPI group is like lacking momentum. But I would say that this group has like ramped up momentum, wouldn't you say, Faye? But I think
each passing week that goes by, I feel as though the engagement is getting more and more. So initially, as part of like when we were doing a needs analysis and when we were having the initial discussions, you could see there was some people who maybe weren't engaging as much as others. Now everybody's kind of really, really bought into it, and I think the reason that people have bought into it so much stems back to not only obviously Paula's lived experience, but the fact that the rest of the team took the time and effort to do the needs analysis and they listened to what the women are saying. And I think that will be mirrored in when we go into the prisons to do the research. I think you will get people buying in and really listening and really wanting to engage, because I think the LEAG team will hopefully go in and mirror kind of the way they've been treated, the way they've been listened to by the whole team, and I think that will show when they're dealing with the people living in prison.
I think the research team have really taken on board, haven't they? When they go in and do the research, they're being like representing the LEAG, aren't they, in that space, and like being informed. And you can sense that a real openness in this research team, like a genuine real openness, and like we are a team. And I think that's what's really interesting here as well, is that it's not like the PPIE is like some adjunct to the research that's like off on the side.
Yeah.
It's literally like a joyful meeting that we all like to come to. And I think, I don't know how that's happened, and we're definitely going to be doing some reflection and thinking about how that's happened, you know, what that magic mixture is, so that we can help other research teams build these types of, you know, PPI groups that have momentum and deep levels of engagement, which in the trust that's emerging, it means that people feel safe, people speak more openly, people talk the things out in terms of advice that they maybe would have felt nervous to say in the past. You know, they are challenging, you know, they were very challenging about this focus group idea, you know, like no, that definitely won't work, you know, no, posters won't work, no, you know, like, and to get that level of trust is something that we need to decipher, and we're going to be some thinking about methods papers that potentially come out of this. So it's a very interesting project so far.
I just come in, Paula, as well. I mean, obviously your lived experience was many years ago. Mine was fairly recent, and
yeah,
I've lived and breathed other researchers coming in to establishments to try and get research on people or try and ask people questions, and they get it so wrong because of the approach. And prior to being involved in the LEAG group, I suppose I haven't kind of thought about what researchers do prior to doing the research. And all I can say is the research team here, Fleur, Hannah, it's been absolutely fantastic. They've taken every single thing on board. The girls have been open and honest with the way they think it'll work, but it really, really has been reciprocated, and it's what's going to make the biggest impact, because I feel when the research team go in and do the research, they will see the engagement they get from the women because of this kind of underpinning work that's been done prior to going in and actually carrying out the research. So massive thank you, and I think that's echoed by every single one of the LEAG group. They feel as though they're being listened to, and it's meaningful for them. So yeah, thank you very much.
Brilliant. I think that we come to the end of our presentation.
Absolutely. Yeah, brilliant. Thank you, Faye. And over to you, Claire.
Yeah, I'm just totally inspired by it all, to be honest, as I think a lot of people have been as well. So just huge congratulations to you all, and also huge thanks both to Paula and to Faye for sharing your experiences. You know, it's just, yeah, I'm a bit speechless, to be honest.
Yeah, I would like just to add something here as well, is that we have all looked after each other as well as a team. So I think when you do have this like quite close proximity to the actual lived and living experience, so we do have people on the group who are quite ill, you know, and that can be, and we do hear things that are quite traumatic, you know, and these are not people who are at distance from us, they're in the team. And I would say this wider team has looked after each other as well. And I, you know, like I, as a sort of a co-researcher, I don't know what my technical term is for my involvement in the team, I have never felt either as a person, as Unlock, as the third sector provider essentially of the PPIE, I have never felt like the commission service. I have felt like integral to the team. You know, Tammi and I speak on WhatsApp, you know, it is you know, it's Fleur, Hannah, we're all meeting each other, you know, like in other parts of the project all the time. So it has, I think that is very critical to understand about this PPIE group. It's been, everybody's made space in their busy work life to connect with the PPIE and embrace it as the heartbeat of the project.
Yeah, it hasn't just been like a tokenistic bolt-on, basically.
No, not at all.
I think that came through, you know.
Yeah, not at all. And, you know, like, and so I have literally just felt like we are the research team, like the PPI group, Paula, everybody is the research team. We are all the research team. Yeah.
Yeah, it's fab.
I was just going to add to that, Paula, that I think it's really important as academics, we're not coming to this space just as like detached researchers. We're coming to this space as mothers, daughters, professionals with our own lived experiences that might not be within the criminal justice system, but it's about how you bring those other parts of yourself beyond being a detached researcher. And I think the other thing is because so much of when we work around women in the criminal justice system, it is, let's face it, lots of it is really depressing. And the topic that we're exploring is also not particularly uplifting. But we've worked really hard to create this as a much more generative space. It's a space of power and connection and collaboration. That's not to say that people haven't experienced huge amounts of trauma, but it is about coming to that space as like a shared as kind of shared power and collaboration about how, despite all of that trauma and all of those experiences, how you can still turn up and be part of generating justice in that kind of moving forward.
Oh,
Yeah, and that's absolutely right. And Paula, is on another study with me as well. And it's about it's about her being a proper co-applicant. She's not tokenistic, and it's what we fight very hard against in all of the work that we do in this area. And it's about drawing on what Faye was saying there as well, about the fact that they are part of the research team. They are the research team. They're not a bolt-on. They're not just something that we go to now and again to pass things through. We work collaboratively with them and co-produce everything with them. From day one, when we have the research idea, that's where Paula was starting at the start of the talk. From day one, when we were even putting the application together, wasn't it, Paula? We worked straight away, building the application from the ground up with our LEAG.
And Tammi, just to endorse that, I think the other thing that's of interest here is that the financials really stack up as well. So I have been involved in PPIE work before where the proportion of the budget that is given to PPI is quite small. And this has been, like, from the get-go, a very generous allocation of my time. For instance, I think it's over 10% of my time is allocated to this project, and there's a very generous PPIE project allowance, a line that enables us to pay the NIHR involve rate. It means that there's space for people to come together, it's not like we haven't just scheduled 4 meetings throughout the whole course of the project. We are meeting on regular intervals, which also helps with the momentum and also helps with this idea of being part of the research. I think when you're like only costed in for ad hoc groups, then you feel like an ad hoc thought, don't you? So I think the costing is very, very important. The financials are very important to be mindful about.
I think we all need a Paula and a Faye within every research project, to be honest.
Or we need to build the approach, don't we, and embed it so that and there are so many. I think what I've also learned from this project is that all the women on the LEAG that have come together and are benefiting from this training, are benefiting from this idea of belonging. They are all the next Paula's, the next phase. They are we have to invest in those as well, as research community.
We've just had a question. Sorry, we just had a question in the chat asking, how do you maintain a presence in the community spaces that you recruit from? I think it's Violet who's asked it, and I don't know whether that's aimed towards Paula or
I think
not.
I think that's because it's coming in that there is a building lived experience movement. So I think it's good for the research community to know that, and to know that that's, they can tap into that. There is something that I'm involved in called the Experience for Justice Collective, which Fleur is a member of. It has quite close connection to. So, can put details of that to people. That's a good space. It's a collective, collaborative space between academics, between people with lived experience, leaders with lived experience. And then there are other networks that are emerging, and I suppose for me, over the long term, I've been at the forefront of building those networks, so I know them. Probably we don't do a great job of communicating them outwards, but you know, it's a new field, isn't it? It's only like 20 years old, you know, and it's underfunded, and people are trying to get themselves together in building those sort of networks. But connecting people with lived experience to establish networks is a great idea as well. But yeah, it's also
Paula, the reason I said about that question was because I think it's really important to make people aware that when you do recruit, like I'll just give you a prime example. A couple of our first sessions were just spent talking about, like for the first 10-15 minutes, probably even longer, were just really based around building relationships within the group. So making people feel, when we were first starting out in the sessions, making people feel as though it was a space where they could be totally open and honest. If they wanted to say they were having a bad day, they could come out and feel comfortable saying things like that. And I think one of the things for me that's hit home with, once you have done the recruitment, is maintaining the relationship within the group, who'll then go on and explain about the positive experience they're having as a group, and they'll then tell other individuals who then may be interested in the research as well. So I think I'd just like to go back to both yourself, Paula, and the team, as in terms of Fleur and Hannah, in the brilliant work that you've done building the foundations within the team from the people that you did recruit, to make sure that they were having a positive experience.
And we should name
week
Gloria,
in, week out.
We?
Sorry,
Gloria, Gloria's the RA who's gone on maternity leave. She's, and that was lovely, that in the midst of all that we had a woman who was having a baby and was sharing about having a baby in the midst of it. So it was great team. That's all I can say as well. It's teamwork. Yeah,
like teamwork makes the dream work, as they say.
Yeah.
I don't know if anybody else on the session has got any other questions for the group at all. I can't see any hands up anywhere, so I think we'll draw the session to a close, if that's okay with everyone.
Yeah.
I can say it has been totally inspiring. Absolutely. I don't think I've ever been to a seminar before where we've still got the same number of people on at the end as joined at the beginning. So,
thank you.
It's been fantastic. Thank you so much.
Thank you for inviting us.
Thank you. I hope you get better soon, Tammi.